astigmatism. Astigmatism is astigmatism. Astigmatism is the reflective area where in the reflection of different meridian. When the eye is causing the light ray entering the eye to form focal length instead of the single point. Focal length to form focal length instead of a single point focus. Two types of astigmatism is a regular and irregular. Regular astigmatism, when the reflection power changes uniformly from one. No, when the reflection power changes uniformly from one meridian to another. When the reflected power changes uniformly from one meridian to another. Clinical feature like regular astigmatism, irregular can go to regular and irregular astigmatism. The reflection power changes irregularly across meridian with the principal ages. The meridian changes irregularly across meridian with the principal ages. No, perpendicular. Regular type, with the rule, the vertical edge is more cut. With the rule, the vertical edge is more. The vertical edge is more cut against the rule. The horizontal edge is more cut. With the rule, the vertical edge is more cut against the rule. The horizontal edge is more cut. Is more oblique the principal meridian are at 90 degree. The principal meridian are at 90 degree to each other, but neither vertical nor horizontal. Oblique the principal meridian are at 90 degree to each other, but not but neither vertical nor horizontal. But the vertical nor horizontal. But neither vertical nor horizontal. No horizontal. Yeah. Oblique type regular irregular symptom esto astenopia blurry vision astenopia blurry vision elongation of the object blurry of the vision elongation blurry of the vision elongation of the object sign of the pressure eyelid closure the pressure eyelid closure Pasha eyelid closure partial eyelid closure improve clarity head tilted to like with the horizontal sign healthy to aligned edges with the horizontal of vertical meridian different refractive power chopping into the meridian during the retinoscopy different refractive power observed into meridian during the retinoscopy terminally optical terminal. The prescription of biopercin is based on accurate reflection. Spherical full correction with the shooting with align to correct edges should be used for both distant and near vision. Should be used for both distant and near vision. Should be used for general surgery. And healing. Define healing. Discuss the type of healing. Describe various type of healing processes. What is healing? Discuss the type of healing. Discuss various type of the first stage of healing process. Enumerate the fatal healing. Discuss the mechanism of Kewi. The home healing. Healing is a mechanism of the recovery of the tissue or muscle from the injury. Type of healing, like there discuss the type of healing, primary healing, secondary healing, type of healing, primary healing, home age are approximately with suture. Ages are with suture. There is more epithelial regeneration. The Scottish is linear. Scottish linear and then small. Scottish linear is small. Scottish linear. Scottish linear is small. Scottish linear is small. Scottish linear. More epithelial regeneration. Scottish linear is small. Secondary healing. White Scott. Hypertrophic and contracted epithelialization occur from remaining in the dermal. White Scott. What will be Scott will be hypertrophic and then contracted will be reepithelialization occur from remaining the dermal level. White Scott and hypertrophic contracted reepithelialization occur from remaining Testosterone, the development on and control of local infection is required. The social or scarce can be the training development or control of local infection is required, or local control infection is required to social or skin graft can be used. Skin graft can development and control of local infection. Development and control of local infection is required. Is required. Is required for social or skin graft can be used. Skin graft can be used. Skin graft and skin graft can be used. Skin graft can be used. Skin graft and skin graft can be used. Component of healing stages are inflammation. Component of healing, component of wound healing stages is inflammatory phase or lab phase. Release of inflammatory mediator, many histamine. Many histamine. This usually increasing the capillary permeability. This is really increasing capillary permeability. In first part, we go polymorphism, PMM, leukocyte dominate, and then play the role of scavenger by removing dead tissue, by removing dead tissue. First part, we go polymorphism, PMM, leukocytes dominate and play role of PMM, play role of scavenger by removing the dead tissue. Prophetic phase or collagen phase. Prophetic phase, primitive phase, prophetic phase in the first what I go was in day 3 to 5 volume of the diminish in number and monocyte whose play the role of scavenger or increase monocyte by day 5 and 6 paraplus appear which give rise to further collagen which literally converted collagen by pro-collagen by photocollagen hydrolyzed by an enzyme photocollagen hydroxylase which is literally converted collagen by photocollagen hydroxylase and ground system healing binding of collagen fiber healing binding of collagen fiber because polysaccharides again and ground system healing polysaccharides and ground system healing and binding of collagen fiber photocollagen hydrolysis and oxygen fiber vitamin iron vitamin C from collagen photocollagen hydroxylation collagen hydrocollagen Revitalization of growth mainly from the age of the womb. The migration from the womb to migration cell. Revitalization of growth mainly from the age of the womb to cell migration and multiplication. Remodeling or maturation phase. Remodeling also called maturation phase. Brought by myofibroblast. Over between 5 to 15 days. They reduce the size of the womb to the age of the womb. They reduce the size of the womb but to the age of the womb. Phase of scar formation. Phase of the scar formation. Fibroplasia laying and laying of the collagen increase. Fibroplasia and laying of the collagen increase. Utilization continue. Fibroplasia and then laying of the fibroplasia and then laying of the collagen increase. Epithelialization ingrowth of lymphatic and nerve ingrow the lymphatic and nerve fiber. Remodeling of collagen fiber. Remodeling of collagen fiber take place with cicatrization. Resulting in scar. What is this? Remodeling of collagen take place with cicatrizity, transactions resulting in scar. Get everything meaning like probably get systemic like fatal feeding like with the age infection, jaundice, malnutrition, systemic infection, inflammation, systemic infection, viral infection, diabetes, corticosteroid, immediate corticosteroid, everyday corticosteroid, everyday corticosteroid, cytosic drugs, cytosic drugs and uremic, cytosic drugs and uremic patient, cytosic drugs and uremic, cytosic drugs and uremic patient, cytosic drugs and uremic patient. La la la. Local cytosic drugs, uremic patient, cytosic by uremic patient. Local pH increase in human fats, pH increase in human fats. Local infection, poor blood supply. There will be local infection, poor blood supply, hypoxia, ionized radiation, foreign body and tension, hematoma, foreign body and some of the foreign body tension, hematoma, some keloid, keloid. It is a perforation of the immature paraplus with immature blood pressure. Perforation of the immature paraplus with immature blood vessel. Immature blood vessel is a proliferation of immature paraplus with immature blood vessel. It is not a true tumor, but will have a marked tendency for local recurrent excision. It is not a true tumor, not kinetic the shape of butterfly, things shape of butterfly over the stand which is the most common site of things shape of over the stand which is the most common site of it is extremely difficult to treat or over the stand or collagen bundle as collagen bundle as collagen bundle as collagen bundle general features several itching in this present there be itching margin tender vascular red vascular red erythematous clone like process vascular red erythematous clone like precipitating fetal black race black rice TB patient, several itching is present, emerging gender, vascular red, preceding feather, black rice, TB, incision, over sternum, earlobe, incision over sternum, vaccination site, injury history. Does not become small, ulceration infection, nature history, does not become small, ulceration treatment. It is difficult injection of steroid preparation such as dry amcinolone acetate, that is skin cord injections have been found to be extremely useful. It is threatened the killer. This within the killer. In the lesion, then they have been found to be extremely useful. It threatened the killer. Intraocular excision and skin grafting. in intracellular excision and skin grafting are tried are to be tried last. Recurrent is common care should be taken not to extend the excision, not to extend the excision onto the normal excision, not to extend the not to extend the excision onto the normal. Into the normal surrounding tissues, silicon application, tropical retinoid, silicon application, tropical retinoid, tropical retinoid. What is womb? Discuss a different type of womb. No, how do you mean this womb in gender? So it is continuity and breaking the surface. Discontinuity and breaking the surface epithelium. Discontinuity and breaking the surface epithelium. Classification. Simple versus complex one. Simple one involve all the skin. And complex one involve the underlying nerves and muscle. Nerve muscle involving the underlying nerves, vessels, and tendon. Open and close one. Simple and complex one. Open and close one. Close one. Hematoma, abrasion, collision of blood, hematoma, collision, soft tissue injury, without skin breaking, without breaking skin, without corrosion, without soft tissue injury, without breaking skin, abrasion, epithelial, without mixed scratch, abrasion, it is painful due to free nerve, and it is painful because of the free nerves and because it is because of the free nerves and because of the free nerves and open, like penetrating, open or penetrating, lacerated incision cross. Penetrating, open or penetrating, lacerated or incision, lacerated or incision, cross. Acute and chronic wound, tidy and tidy wound, give principle of open wound management. Medicine observation in hospital, so monitoring the vitals, systemic antibiotic depend on the extent of the wound contamination. Injection tetanus for prophylaxis against tetanus. Treatment of the other wound by cleaning. Dressing, and treatment of the wound by cleaning, dressing, and healing of the wound. Healing by primary intention occur in a clean incest wound, surgical incision. Healing by secondary incision occur in an infected wound, or in those with skin loss, or skin loss produce ugly scar. Skin loss produce the ugly scar. Skin loss produce ugly scar. No, cleaning and bandaging. Cleaning and bandaging, sprain, epidural fracture, and you will be suturing and transport. Active bleeding, you gotta stop the bleeding first. And an IV line, resuscitation, IV line resuscitation. IV line resuscitation, active bleeding, stop bleeding, IV line resuscitation, wound management. Classify different type of ulcer, how within brief blood investigation management of diabetes ulcers, different type of ulcer. And ulcers, the discontinuity of the skin ulcers, discontinuity of the skin or muscular membrane, discontinuity of the skin or membrane, which according to microscopic depth of the tissue. Is it discontinuity of the skin or muscular membrane, which according to microscopic depth of the tissue. Classified based on pathology of clinical feature. Pathology classification will be non-specific. Non-specific ulcers, they are traumatic venous and ulcerative ulcers. Non-specific traumatic venous, arterial ulcers like Bergen disease, most common. Burger disease, atherosclerotic, atherosclerotic. Neurogenic leprosy, neurogenic tropical leprosy, tropical ulcer, diabetic foot. Yeah, all non-specific ulcer, diabetic foot, tropical ulcer, diabetic foot. Tropical ulcer, diabetic foot ulcer, Black division, specific ulcer like tubercular, tubercular ulcer, syphilis ulcer, specific ulcer like tubercular ulcer and syphilis ulcer, melanoma ulcer, squamous cell carcinoma, melanoma ulcer, melanoma ulcer, squamous cell carcinoma, clinical classification spreading. Linguist vision like spreading careless and spreading careless and healing, spreading careless and healing. In diabetic foot ulcers, diabetic foot ulcer is a trial that maintain the this one. Diabetic foot is a trial that mainly consists of three. There will be neuropathy, infection, nerve infection, atherosclerosis, atherosclerosis, infection, infection and neuropathy, is a neuropathy, the grading of the big foot ulcer, yes, what grading in group, grade auto, grade auto, 5, grade auto 5. Grade 0 to 5, grade 0 to 5, 5, specific meridian ulcer, specific non specific idea because of dietary food ulcer, grape, grape pollination, non skin change, grade 1, superficial ulcer, grade 1 is grade 2, ulcer extension, involve ligament, tendon, invasion, ulcer extension, involve ligament, tendon, joint, no noises or osteolysis, deep ulcer with abscesses or osteomyelitis, grade 3, deep ulcer with abscess or osteomyelitis, the grade 4, gangrene of the portion of the forefoot, gangrene of the portion of the forefoot, gangrene, grade 5, extensive gangrene of forefoot, extensive gangrene of the portion of the forefoot, gangrene, extensive grade 5, extensive gangrene of forefoot. Investigation is in a complete blood picture usually demonstrate the high total complete blood picture usually demonstrate the high total blood fasting blood sugar. Complete blood picture demonstrate a high total complete blood picture. CBP, blood fasting blood sugar, postpartum blood sugar, and glycolated hemoglobin to be done, and glycolated hemoglobin, to be done. Plus also be sent for culture sensitivity, plus also be sent for culture sensitivity. Common micro, plus also be sent for culture sensitivity. Common micro, E. coli, Staphylococcus, E. coli, common micro, E. coli, Staphylococcus aureus, Staphylococcus aureus, and Capsula, E. coli, Staphylococcus aureus, and Capsula. History of the food to be done to rule out oral osteomyelitis. History of the food to be done to rule out osteomyelitis. Liver function test, X-ray, lower limb artery duplex, lower limb. Lower limb artery, again, duplex, again, hand heel Doppler, treatment of diabetic foot ulcers, control of diabetes, control of infection, control diabetes, control infection, control diabetes, control infection, local treatment of the ulcer, right, department, we use mid-joint grading of department, grading of department, various type of surgery for DFU, diabetic foot ulcers. The various types of care of the patient as a whole, care of vascularization of the foot, revascularization of the foot, vacuum assisted closure therapy we use. We can use vacuum assisted closure, vacuum assisted closure therapy, limited access dressing, limited access dressing, vacuum assisted closure therapy, limited access dressing. Control infections, common use antibiotic from fluoroquinolone and cephalosporin, chloroquinolone, fluoroquinolone and cephalosporin. Local treatment, department dressing using iodine, depermanent dressing using iodine solution in infection overloading ulcers. Depermanent dressing using iron solution in infection and overloading ulcers. Breast type surgery for diabetic foot. Breast type surgery for diabetic. Breast type diabetic for surgery for. This articulate those excision. This articulate those excision of the metatarsal development for foot amputation, multiple fascitomy, multiple fascitomy, for foot amputation, excision of metatarsal bone, disarticulate those. Very stable surgery like disarticulated those, excision of metatarsal bone. Incision forefoot amputation, multiple fascitomy, amputation below the knee, above the knee, amputation below the knee, or above the knee, revascularization, infrainguinal bypass, infrainguinal, these are the things, infrainguinal bypass, revascularization, infrainguinal bypass, care of patient as a whole, ensure patient blood pressure and lipids are under control. If patients are on aspirin, then this will be stop further surgery and restart related revascularization of the foot. We use the Doppler ultrasound assess both anatomical function and ability. Revascularization of the Doppler ultrasound assess both anatomical function and ability. Angiography is the gold standard. Angiography is still against standard infection disease. Describe pathological clinical feature of gas gangrene, outline management, step in prevention and management of gas gangrene. It is a highly fatal, rapidly spreading, infection by Clostridium. Gas gangrene is highly fatal, rapidly spreading infection by Clostridium organism carrying myonecrosis, infection by Clostridium organism carrying myonecrosis. Gas produced by organism consists of mainly nitrogen. Gas produced by organism of nitrogen. Other are hydrogen, oxygen, carbon dioxide, etiology most commonly by Clostridium perfringens 6%, Clostridium septica. Clostridium septica, Clostridium histolytica, clinical feature, BAF, that is the name of it. Severe pain in the limb, clinical feature of the gas gangrene, severe pain in the limb. Severe pain in the limb, limb swelling, fever, and toxicity over there. The bronch fluid escape. One have a sickly sweet odor, crepitus, bronch fluid, cracking sound due to the bone bubbling, rubbing against each other. Crepitus, crackling sound due to the bone rubbing against each other. Skin khaki color due to hemolysis. Skin khaki color due to hemolysis. There will be anxious, hypotension, vomiting, and low grade fever. There will be low grade fever, low grade vomiting also will be there. Low grade fever, vomiting, hypotension, and anxious, crepitus, severe pain, and then severe pain in the lip, thick bone fluid escape. Injury. These are the pathological changes. Injury will be road traffic accident, or contact to solve foreign body clothing, spreading in anaerobic cellular, spreading in aerobic regions, low oxygen, breakdown of muscle collagen, muscle change the color, breakdown of muscle collagen, muscle change the color, lose contractility, and muscle change the color, and lose contractility. Damage the blood, damage the blood vessel, myonecrosis, damage the blood vessel, myonecrosis, ischemic necrosis gangrene, ischemia necrosis gangrene, dull red, green, yellow, red, green, and black color. Multiplication of organism. Extensive edema, gangrene of the lip muscle, we spreading infection, gangrene of the lip muscle, we spreading infections, production of gas by the bacteria, H2S, production of the gas by the bacteria, ischemic necrosis, gangrene, dull red, green or black color, myonecrosis, damage to the blood, the myonecrosis would be the multiplication of organism because of the damage of blood vessel, the myonecrosis, and breakdown of the muscle collagen, muscle change of color, loss continuity, the ischemic necrosis, gangrene, multiplication of organism, excessive edema, gangrene of the lip muscle was spreading infection was septicemia and dead septicemia. Gangrene of the lip muscle with spreading infection because production of the gas by bacteria H2S. By bacteria, production of the gas by H2S and then H2S and ammonia. As the diagnosis or microscopic exam impulse after examination of other questions, microscopic exam impulse after given some sending. We use negleration, we use negleration, Clostridium produce lecithinase positive for Clostridium. This is the declaration. Clostridium declaration. Clostridium produce lecithinase positive for Clostridium strain and X-ray and CT scan. X-ray, CT scan, X-ray, CT, and MRI treatment, antibiotic treatment, antibiotic injection, crystalline penicillin, 10 to 20 like we need 4 to 6 hours should be possibly we use crystalline penicillin 10 to 20 10 to 20 legs we need 4 to 6 hours for 7 days a day. SIRS, systemic inflammatory response syndrome can be caused by Clostridium septicemia, caused by systemic inflammatory response syndrome can be caused by Clostridium septicum. It is treated by clindamycin 600 to 900 mg hourly. Egg is treated by clindamycin 600 to 900 vancomycin 1 gram 1 gram 12 hourly or metronidazole 5 mg egg hourly or vancomycin metronidazole or clindamycin chemical by Clostridium surgery, emergency surgery, we use excision of the dead muscle and necrotic tissues in several ill patients with hypotension with hypotension. So amputation is the only option. Amputation is the only option. Hyperbaric oxygen therapy. It reduces toxic formation because the origin gram positive, gram positive and anaerobic, gram positive and anaerobic, gram positive and anaerobic. Supportive treatment, blood transfusion before, during, and after surgery. Polyvalent anti-gas gangrene solution. Polyvalent anti-gas gangrene solution. What are anaerobic infection solution? Right. Common feature management method in intelligence. What are anaerobic infection are infection caused by anaerobic bacterial microorganism that do not require no oxygen for growth and may even die in pressure. Infection. This infection often involve dead tissue, close spread. This is often involve dead tissue, close spaces or necrotic area where oxygen level are very low. Common anaerobic bacteria, gram positive anaerobic, Clostridium SPB, Clostridium perfusion, example like Clostridium perfusion, Clostridium tetani, Clostridium difficult are there. And Pentos, Streptococcus, species Back the steroid combination gram negative anaerobic better rate fragile better fragile Phosphobacterium species Phosphobacterium species Phosphobacterium species source of anaerobic infections in like mouth GI source of anaerobic infection even in the mouth GI even in the mouth GI Mock GI, GI or fever genital tract clinical feature will be force mailing discharge will be there. Force mailing discharge will be there. Tissue necrosis will be there. Post mailing discharge, tissue necrosis, and gas formation and gas formation. Management will be metronidazole, which antibiotic, metronidazole, clindamycin, penicillin, plus beta lactamase inhibitor, plus beta lactamase inhibitor. Plus beta lactamase inhibitor plus beta lactamase inhibitor plus beta lactamase inhibitor tetanus is a serious disorder caused by toxin is a serious disorder caused by toxin of the clostridium tetani by toxin of the clostridium tetani affecting nervous system giving rise to muscle contraction giving rise to muscle contraction of the neck back muscle of the neck back and jaw muscle condition of the neck back and jaw muscle it is popularly called as lockjaw. This is called popularly called lockjaw etiology caused by the by closing the swollen doesn't have drumstick caused by the swollen doesn't have drumstick like brain possible root of infection umbilicus cord possible root of infection umbilical cord and unit and umbilical cord and unit on a minor injury with rusted nail air brushing with minor injury rusted nail air brushing and tattooing minor injury with rusted nail and air brushing or tattooing and infection septic abortion or septic abortion and surgical operation are some I think yeah. So septic abortion surgical operation also no one not the doesn't produce by organism are the doesn't produce by microorganism are tetanus that is neurotoxin tetanus neurotoxin tetanolysin that is hemolysis tetanolysine that is hemolysis and neurotoxin spamium neurotoxin lysine hemolysis it reaches the CNS along the engine it reaches the CNS along the engine of the nerve or the motor nerve that doesn't get fixed the motor that doesn't get fixed the motor shell of the anterior horn shell the motor shell of the anterior horn shell the doesn't really speaks to the motor the doesn't really speaks to the motor end but again in the following way it inhibits the release of corticosteroid the doesn't it inhibits the release of corticosteroid. The toxin once fixed to the nervous tissue cannot be neutralized. Toxin once fixed to the nervous tissue, the toxin once fixed to the nervous tissue cannot be neutralized. Dysphagia, stiffness of the jaw, and then reflex spasm is called the period of onset. There will be dysphagia, dysphagia of the jaw, and reflex spasm, reflex spasm is the period of onset. Favorable condition non-immunity, favorable condition no immunization, foreign body injury, and improper sterilization. Improper sterilization. Species type of tetanus neonatal egg days disease, tetanus neonatal local tetanus, and syphilic special type of tetanus neonatal egg days disease, local tetanus, syphilic tetanus, bulbar tetanus, syphilic tetanus, bulbar tetanus, latent tetanus, ocellaris tetanus, and post-operative tetanus. Clinical feature autoimmune dysfunction, increasing basal semitic tone, manifesting as tachycardia. Clinical feature autoimmune dysfunction, increasing basal semitic tone, they will increase the basal semitic tone, they will increase the basal semitic tone, manifesting as increasing tachycardia, bladder or bowel of dysfunction, bladder or bowel dysfunction, level hypertension, parexia, pallor sweating, parasitic sinuses of the disease, paresthesia, paralytic, and paresthesia and sinuses of disease. Complications include pneumonia, urinary tract infection. Complications include pneumonia, urinary tract complications include pneumonia, urinary tract infection. Signs and symptoms: trismus, or lockjaw, trismus, or lockjaw syndrome. According to severe contraction of the mesenteric muscle, resulting inability to open the molar development. This is the most common symptom of the dysphagia. According to spasm of pharyngeal nerve, pharyngeal muscle. Dysphagia. According to the spasm of the pharyngeal muscle, the neck rigidity will be there. Rigidity of the back of the neck, rigidity of the back muscle, the racial sudden due to the spasm of facial, racial sudden due to the spasm of the facial and nasal muscle, racial sudden due to the spasm of the facial and the generalized convulsion also with the mild temperature and mild temperature. Mild temperature, treatment of establishment, general management, special management, general management, admission and isolation, home care during drainage of balls, home care, drainage of balls, excision of the neighboring tissue, remove any foreign body tightness, that's why so we can use 0.5 intramuscular anti-tetanus serum, 50,000 units IVM and 50,000 units low IVM, 50,000 units low IVM, human anti-tetanus goblin, human anti-tetanus goblin in 3,000 4,000 units IM. I am crystalline penicillin and 10 likely unique. I am 6 hourly is a dose of choice. 6 hourly is a dose of choice. Is a dose of choice again get closer than is a dose of choice again. Is a dose of choice again closer than the metronidazole 5 mg IV egg orally for egg delivery. Metronidazole 5 mg IV egg orally for 10 days. For 10 days specific management. Normal case because there is only tonic rigidity. There's only tonic rigidity without spasm. There's only tonic rigidity without spasm. Without spasm or dysphagia. Benzodiazepine and morphine. Serious treatment. Chlorpromazine may decrease the sympathetic activity. Chlorpromazine may decrease the sympathetic activity. Benzodiazepine and morphine for pain. There's only tonic rigidity without the spasm. No case. Then we can use benzodiazepine and morphine and chlorpromazine moderate phenobarbiturate. We also use for phenobarbiturate and diazepam. Phenobarbiturate. There's compulsion so diazepam and phenobarbiturate. Benzodiazepine and chlorpromazine. Benzodiazepine and chlorpromazine. Seriously, three cases they have dysphagia and reflex spasm, and then there's a restricted and we use tracheostomy. We use tracheostomy, and there's a restricted also needed and tracheostomy. Dangerously case, dangerously case like patient where we measure cyanotic convulsions, magnesium sulfate. Patient will measure cyanotic convulsions and magnesium sulfate may be used to treat autonomic complication and central spasm. Magnesium sulfate may be used to treat autonomic complication and may be used to treat autonomic complication and control spasm and control the spasm. Prophylaxis, tidiness, neonatal may be prevented by two tidiness toxin injection 0.5 ml IM to the mother in 2 trimester in second trimester. Two tidiness toxin injection 0.5 ml to the mother during the second trimester of pregnancy. Infant and children IM with DPT. Infant and children are with DPT. Probably game. CCPT management, general principle, isolation in a quiet radar amidinization, maintain airway breathing and circulation, neutralization of those engine, tightness of globin use, neutralization of those tightness simulation, 3000 international unit IM, single dose, neutralize a non-bond dosage. Control infection, won't be prevalent, remove the necrotic tissue and foreign body, antibiotic, antibiotic, metronidazole, 5 mg GIV, 6 hourly, 6 hourly, 7 to 10 days, 7 days, control muscle spasm, benzodiazepine, control muscle spasm, diazepam, 5 to 1 to 10,000 mg equally, muscle release, baclofen, weapon in several cases, support cases may need trigger stability, active medication, begin full course of the begin full course of the sorry 0.5 milliam 06 6 months 06 weekend 6 months 06 weekend 6 months carbicals what carbicals 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 is a 9 yeah. Oh yeah, let's take break, yeah. Good. What I want you will do. Full course of it. Looking for you. Da, 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 da. Come on, let's go. Corbicles is a deep-seated, multilocular skin. Deep-seated, multilocular skin and subcutaneous infection involving multiple hair follicle. Deep-seated multilocular skin and subcutaneous infection involving multiple hair follicle. Usually involving multiple hair follicle. Involve multiple hair follicle. Usually goes by cephalocasaris, common cause, nappy of the neck, back, shoulder, one side will be on the neck, back, shoulder, thigh, and product. The etiology will be poor hygiene, diabetes mellitus, immunosuppression, and malnutrition. Pain, there will be endurable swelling, there will be pain swelling, multiple pulse discharging multiple pulse discharging cellulitis and edema, multiple pulse cellulitis and edema, fever, malaise, fever and edema, fever, malaise, typical patient aseptic malaise. Complication will be sepsis, diabetic ketosis, contraplastic, antibiotic, empirical, clozicillin, antibiotic, clozicillin, fabric, MZ, or Kewi, cefazolin, IV, or vancomycin, cefazolin, IV, or vancomycin. Surgical management, insertion and drainage, and exercise necrotic tissue, exercise necrotic tissue, exercise necrotic, and exercise necrotic tissue, exercise necrotic tissue, and exercise necrotic tissue, and exercise necrotic tissue, and exercise necrotic, and exercise necrotic tissue, and exercise necrotic tissue. And exercise necrotic tissue. Surgical management, insertion, drainage, exercise necrotic tissue. Cefazolin, or cefazolin, What are the damages and segmentation damages? Damages is a benign developmental process containing endodermal element like here. Is a benign developmental cognitive containing endodermal element like hair surfaces material, teeth and bones. Surfaces material containing hair surfaces. Endodermal element like hair surfaces material, teeth or bone with mixture of sweat surface and discriminated epithelium with a mixture of sweat surface and discriminated epithelium cell and sweat surface and discriminated epithelium cell is lined by squamous epithelium is lined by squamous epithelium squamous epithelium. Clinical type of dermatitis congenital sequestration dermatitis implantation congenital sequestration dermatitis implantation teratomy teratomatous dermatitis implantation teratomatous dermatitis tubular embryo dermatitis tubular embryo dermatitis teratomatous clinical type of dermatitis sequestration dermatitis implantation teratoma implantation tubular embryo dermatitis treatment excision of the cyst treatment of the excision of the cyst origin of dermatitis the faces develop from fibrosis origin of dermatitis dermatitis develop from fibrosis two medullary two mandible and one frontal one frontal two medullary two mandible. Dermatitis occur in the line of embryonic fusion in the line of dermatitis occur in the line of embryonic fusion of this process. Dermatitis occur in the line. Dermatitis occur in the line of embryonic fusion of this process. Sequestration dermatitis. They occur along the line of embryonic fusion. They occur along the line of embryonic fusion. They do dermatitis. Bin dermatitis. They go along the line of embryonic fusion due to dermatitis being buried in a deep blend. The cell weaves are sequestrated in a subcutaneous plant proliferate and liquefy and proliferate and liquefaction to form and liquefy 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 to form. The cell weaves are sequestrated in a subcutaneous plant proliferate and liquefy the form as grow in the mesoderm. Even though they are congenital, they manifest as a swelling. They manifest as swelling during childhood or in later life, and they can occur anywhere in the midline of the they can occur anywhere in the midline of the body of the body. Body of the face, body of the face, body of face, body of face. They can occur anywhere in the midline of the body of the from external and internal conditions sequential damages occur along the line of brain fusion. Due to damage have been buried in the brain. The cell are sequestrated in the subcutaneous plant proliferate and liquefy the form. And then the subcutaneous plant proliferate and liquefy the form says it indent the mesoderm. Even though they are cognitive, the manifest as a selling during childhood or later life, they can occur anywhere in the middle of the body, in the midline of the body or face, midline of the body. They can occur anywhere in the midline of the body or face. They can occur anywhere in the midline of the body or face. External and internal and angular dermatitis. At the fusion line of the frontal cell and the maxillary processes versus at the fusion line of the fusion line of the frontal cell and the maxillary process. The median cell damages at the root of the nose. At the root of the nose. External angular damages. The median cell damages at the root of the nose. Sublingual damages. Pre and post auricular damages. And angular damages. Efficient. The fusion of the frontal nasal and medullary process median nasal damages, sublingual damages, pre and post auricular damages, complication damages, infection, suppurative infection, suppurative abscess, overwhelmed with torsion. Conventional they'll be overwhelmed with no torsion. Separated daily assessment. Daily assessment is a feature. Though cause neither the system manifests in childhood or during the adolescence. If you guess in 30-40 years, the cause the cyst manifests in childhood. The cyst manifests in childhood or during adolescence. If you guess it started 40 years ago. Typically, the patient present with painless, slow growing swelling. Typically, the patient present with painless, slow growing swelling, soft cystic and flushing. The transillumination is negative. Soft cystic and flatten inflammation the learning body defect give you the clue to the diagnosis. Body defect give clue to the diagnosis. Classical location of the cyst along the line of vision is a feature of sequestration damage. Is a feature of sequestration damages. Classical location of the cyst is along the line of vision. Classical location of the cyst along the line of vision is a feature of sequestration damages. Implantation damages. This is common in a woman. Implantation damages. This is common in a woman. Agriculturalists who sustain repeated minor sharp injury, sharp mind injury, repeated mind injury following such injury. If you epithelial muscle get implanted into the subcutaneous plant, that's they develop implantation damages. They get implanted into the subcutaneous plant as they develop into the subcutaneous sequential damages. Damages sequential damages. Sequential damages. It's regular damages. Without complication damages. In the future, implantation damages. In the future, level lymphoma is a considered is a benign tumor composed of mature deposit tissue, typically located in sub is a benign tumor composed of mature deposit tissue, typically located in the subcutaneous plane. Most common benign tissue tumor. Common cause of big common cause of big shoulder neck was a major deposition, typically located in the subcutaneous brain. Most common benign soft tissue common cause of big shoulder neck arm big shoulder neck arm clinical feature soft lobulated painless swelling soft lobulated painless swelling slow growing soft lobulated painless swelling soft lobulated painless swelling slow growing mobile motivation investigation usually clinical ultrasound hypersound MRI CT scan empty pulmonary MRI CT scan empty pulmonary complication cosmetic deformity pain liposarcoma medicine surgical recession definitive treatment indication large size pain or pressure symptom indication large size pain or pressure symptom cosmetic concern. Morin or Baker's Baker's also called as Baker's or Morin Baker's or Morin Baker's is a fluid field is a fluid field flowing located in the popular fossa. Popular is in the popular fossa, arising from the herniation of the synovial membrane of the knee joint in the popular fossa. The popular fossa. Arising from a herniation of the synovial membrane of the herniation of the synovial membrane of the knee joint and bursa and the knee joint and the bursa knee joint. Herniation of the synovial membrane. Arising from the herniation of the synovial membrane of the arising from the herniation of the synovial membrane of the knee joint and bursa. Etiology: osteoarthritis, rheumatic arthritis, rheumatic arthritis, middle age, osteoarthritis, rheumatic arthritis, middle age, and knee fusion, rheumatoid arthritis, middle age, knee fusion, osteoarthritis, investigation ultrasound, MRI, X-ray. The complication will be rupture. Management: treat underlying joint pathology, treat the underlying joint pathology, and set for arthritis, DMARDS, hypermobility, and set for arthritis, DMARDS, hypermobility, aspiration of cysts, corticosteroid injection, aspiration of cysts, corticosteroid injection, surgical excision, if persistent, recurrent, or compressive. Surgical excision, if persistent, recurrent, or compressive. If persistent, recurrent, or compressive. Epidermolysis, also known as sepsis. It is a misnomer. Epidermolysis is sepsis. It is a misnomer. According to the obstruction of the obstruction to one of the sepsis, according to obstruction to one of the one of the sepsis, the one of the obstructions, the size will be skull, face, size will be skull, face, big scrotum. There's no coin palm for epidermolysis. Sepsis is a misnomer. Epidermolysis is a there's a popular this popular called sepsis is they are slowly growing. This is popular called sepsis. This popular called sepsis. They are slow growing and then they appear in early never of the hood. Hemisphere or spherical swelling located in Germany. Hemisphere or spherical swelling. There will be hemispherical swelling located in Germany. A dark spot in the center field with keratin is the two feature of this. Is a dark spot located located in the center field with keratin. Located in the center field with keratin is the only feature of this. It is smooth surface, round border, smooth surface, round border, soft and put in the consistency. So putting consistency and this not tender. The cyst can be molded into the different shape. The shape can be molded. The cyst can be molded into different shape. Which described as sign of molding. Sign of indentation. In the scalp, the loss of hair is a feature over the swelling because of the constant slow expansion of the cyst. In the scalp, the loss of hair is a feature over because of the constant loss of treatment incision and evolution of the cyst with the wall incision and evolution of the cyst incision and evolution of the incision and evolution of the incision and evolution of the cyst with the wall complication of infection services horn infection services horn classification and classification and clot bacillar tumor, clot bacillar tumor, tumor. Neurofibroma is a benign peripheral nerve cell tumor composed of swarm cell, fibroblast, and peripheral cell. Is a benign peripheral nerve. Neurofibroma is a benign peripheral nerve cell tumor. Is a nerve cell tumor. Is a benign peripheral nerve cell composed of swarm cell, fibroblast, and perinuclear nucleus. Type will be solitary neurofibroma and proximal neurofibroma. There will be proximal neurofibroma and proximal neurofibroma. There will be solitary neurofibroma and proximal solitary neurofibroma and proximal neurofibroma, proximal neurofibroma. Common site will be skin, common side of the skin, subcutaneous tissue, skin, subcutaneous tissue, skin, subcutaneous tissue, nerve down, nerve down, skin, subcutaneous tissue, nerve down, and spinal cord, head and neck region, finger features, slow growing, slow growing, penicillin, slow growing penicillin, soften on the slow growing penicillin, soften on the slow growing penicillin, soften on the bottom holding same. Slow growing painful solid soften on the bottom holding same. Complication with melanin transformation to the MPNST. Melanin transformation, combination with melanin transformation to MPNST. Clinical diagnosis of MRI biopsy and clinical biopsy of MRI. Clinical diagnosis of MRI biopsy and evidence. Surgical excision is a treatment of chest. Surgical excision is especially in people growing on this finger. Lifelong follow-up F1 did the resubmission. Ignorant cystic swelling, rice bone joint. Ignorant cystic swelling, rice bone joint. Capsular tendon cell is a cystic swelling erasmus joint tendon cell or tendon cell containing ulcer, containing clear gelatinous film, containing from joint capsule erasmus. The erasmus joint or tendon cell containing clear gelatinous film is a dense cystic fibro. Which according to mesoderma, which according to methods distribution of the sensible other sensible cell lining the joint or tendon cells. The direction of the head. The direction of the head is most common. The scuffle articulate. The scuffle articulate. Foot and dorsal of the dorsal. Scuffle articulation of foot and dorsal of the head. The scuffle articulation dorsal of the head. The scuffle articulation of foot and head. Patient between 20 to 50 years, around the album swelling on the dorsal of the hand, around the in the direction of the with smooth surface and a round border with smooth surface round border with smooth surface round. The swelling is densely cystic. The swelling is densely cystic. The swelling is densely cystic and fluctuate transformation is negative. Fluctuate transformation is mobile in transverse direction. It is mobile in a transverse direction. Asymptotic ganglion is better left. Asymptotic ganglion is better left alone. Aspiration of the ganglion and an infection of scleral cell may reduce the size of and an injection of the scleral cell may reduce the size of ganglion. And surgical excision can be done on diagnosis, implantation, diagnosis. Implantation diagnosis bursa implantation diagnosis bursa multiple sclerosis either due to loss of acid from the body or retention of the bicarbonate or retention of bicarbonate. It can be due to loss of gastric hydrochloric acid in vomiting, prolonged nasogastric loss of gastric hydrochloric acid in vomiting, prolonged nasogastric retention of bicarbonate in exchange for loss of bicarbonate, retention of bicarbonate in exchange for loss of chlorine, iron in diarrhea, retention of bicarbonate in exchange for loss of chlorine, iron in diarrhea, excess loss of hydrogen from kidney in exchange for kidney for exchange for potassium, excess loss of hydrogen from kidney in exchange for potassium in severe hypokalemia. Primary secondary hyperaldosteronism. Fever is one of the common acid-based disorder in intensive care unit ICU. Cause hypoventilation and seizure. They cause hypoventilation. They cause hypoventilation, seizure, arrhythmia and difficulty in winning, arrhythmia and difficulty in winning. Arrhythmia and difficulty in winning. Arrhythmia cause hypoventilation, seizure, arrhythmia and difficulty in winning. Treat problem. Most of the metaphysicians are chlorine responsive, administration of saline, and then correction of the potassium deficiency, reduce the risk of ecological series of causes chlorine deficiency 0.0.2 the body weight the 100 minus 7 chlorine the body weight 0.2 the 100 chlorine deficiency shock define shock classify shock how eliminate case of septic shock or hemorrhagic septic shock and hemorrhagic shock. Discuss the management of patient with a septic shock arising from appendicular perforation. With parent and its with the parent pathology, pathophysiology of the hypovolemic shock and hypovolemic shock. Shock is defined as acute failure of the circulatory system to supply blood. Is an acute failure of the circulatory system to supply blood in sufficient quantity or under sufficient pressure or under sufficient pressure in sufficient quantity of the circulating system to supply blood in sufficient quantity or under sufficient pressure into the tissue. Management of septic shock. Removal of septic focus is the main removal of the septic focus. Removal of septic focus is the main method. Early empirical antibiotic therapy, IV like aerial regulators and oxygen support, vasoactive as in like non-epiprine to do vasoconstriction and to rise systemic vasoactive as in like non-epiprine to do vasoconstriction and to rise systemic and to rise the systemic and to rise the systemic vascular resistance stent to normal dopamine dopamine adrenaline may be needed when suppressing issues in patient of refractory issues in patient refractory shock issues in patient refractory shock vascular resistance the normal dopamine adrenaline may be needed when suppression issues in patient of refractory shock type of hypovolemic shock, cardiogenic shock, distributive shock, obstructive shock, hypovolemic shock, loss of weight, and blah blah, hemorrhagical hemorrhagic shock, cardiogenic shock, distributive shock like septic distributive shock, which includes septic shock, anaphylactic shock, and neurogenic shock, distributive shock like septic shock, anaphylactic shock, and neurogenic shock, obstructive shock like tension pneumothorax, obstructive shock like tension pneumothorax, and cardiac management of hemorrhagic shock. Management of hemorrhagic shock and hypovolemic shock, general features, management of the hemorrhagic shock, hemorrhagic shock, hypovolemic shock, general features, hospitalization, SS, epilepsy, airway breathing circulation, immediate resuscitation to prevent vaginal organ damage, provide oxygen, it has monitored to record vitals, obtain two large bore internal versus 18 and 16, two large peripheral line 16 18 GC, do repeat infusion of 500 ml to 1 liter of or repeat or regulators or isotonic normal PCB, FFP, fresh frozen plasma, and platelet will be platelet will be needed in hemorrhagic shock, restoration of adequate circulation, restoration of adequate circulatory volume, restoration of the hemorrhagic shock, restoration of adequate circulatory volume, septic and anaphylactic cardiogenic vasopressure in cardiogenic vasopressure in obstructive shock need thoracostomy, pericardial synthesis in a search of needle thoracostomy and cardiogenic we use vasopression and inotrope, septic and anaphylactic we use heavy fluid. Hemorrhagic shock, restoration of adequate circulatory volume, restoration of adequate circulatory volume, restoration of adequate circulatory volume. Treatment social measures control hemorrhage pressure, control hemorrhage pressure and packing pressure packing this is a method of choice to stop bleeding when the bleeding is stable Packing using roller go with or without adrenaline line to control breathing, to control breathing from the nose, to control breathing from the nose and scalp to control. Packing using roller go with or without adrenaline line to control bleeding from the nose and scalp. Pressure packing the middle thyroid vein during the thyroidectomy. Pressure packing the middle thyroid vein during the thyroidectomy. Centric tube is used to control bleeding from esophageal esophageal varicose and the internal abdomen. Second tube is used to control. Second tube is used to control. Second tube is used to control. Is used to control bleeding from esophageal varicose, internal abdomen, position and pressure. Elevation of the other leg control bleeding from various from various elevation of the leg. Control bleeding from various elevation of the head. Reduce the venous pressure in the thyroid. Elevation of the head and reduce the anti trainer deliver position, anti deliver again the anti trainer deliver position we can use condition control hemorrhage, pressure control hemorrhage, pressure picking position and rest, person and rest, picking up rolling goes with or without adrenaline. Pressure picking the middle thyroid vein during the thyroidectomy. Second is to use control bleeding from esophageal pressure, internal sedation to relieve anxiety, metazolam, sedation to relieve sedation to relieve. Sedation to relieve anxiety, metazolam. Tourniquet indication, reduce the fracture, repair of tendon, repair of nerve, repair, tourniquet, reduce of fracture, reduce of tendon, reduce of fracture, reduction of fracture, repair of tendon, and repair of nerve, repair of pneumatic cuff with the pressure cuff, pneumatic cuff with the pressure cuff, and then rubber bandage, pneumatic cuff with the pressure cuff, and then rubber bandage, surgical method of control hemorrhage, application of surgical method of control hemorrhage, application of ultra-forceps, Spencer well for Spencer well surgical method of control hemorrhage. Application of ultra-forceps to control the bleeding from vein, application of ligature from bleeding with catheterization, determine application of bone waste, silver slab is used to control the silver clip used to control cerebral vessels, surgical procedure, laparotomy and splenectomy from a splenic rupture, hysterectomy for uncontrollable postpartum hemorrhage, hysterectomy for uncontrolled postpartum hemorrhage, laparotomy for control of bleeding from ruptured atopic pregnancy, laparotomy surgical procedure, laparotomy splenectomy for splenic rupture, hysterectomy for uncontrolled postpartum hemorrhage, laparotomy before control of bleeding from ruptured ruptured atopic pregnancy. For atopic pregnancy, from ruptured atopic pregnancy, from ruptured atopic pregnancy, from ruptured atopic pregnancy. From ruptured atopic pregnancy. Above mix of the management will replace the lost blood volume. Will mix of replace blood volume. The primary goal is to restore the tissue provision and oxygenation early. Tissue provision and early oxygenation possible. We use correlate also use pathophysiology of bubble mix of decrease of preload, decreasing stroke volume, hypertension and hypertension. Decreasing preload, decreasing stroke volume, hypertension, hypertension and hypertension. Release of corticoamine and increasing heart rate. Release of the corticoamine and increasing heart rate. Vessel constriction of peripheral vessels to increase the flow of vital vasoconstriction of peripheral, vasoconstriction of peripheral vessel, vasoconstriction of peripheral vessel to increase the fluid and to increase peripheral vessel to increase the flow of the vital organ. Restoration of blood pressure, restoration of peripheral vessel to increase the flow, restoration of blood flow to blood pressure and flow, restoration of blood pressure and flow, and there will be release of corticoamine and increase the heart rate. In several cases, this mechanism may not have substance and irregular provision, deprivation of oxygen, histamine, bradykinin, cytokine release, lytic association, inadequate ATP, and inadequate ATP, the cell loss, cell loss, cell swell-up, cell death, some rising for a particular profession. Separation from a declaration with initial stabilization, initial stabilization, ABC, assessment, putting additional oxygen, high oxygen flow, circulation, start IV, IV fluid, resuscitation. We crataloid, the takes are in 30 ml per liter. Experimental burst period antibiotic within 1 hour. Target aerate and example piperacillin does a big drum 4.5 gram IV egg oil. Piperacillin does a bit of 4.5 hour. The meropenem 1 gram IV egg oil and citrazone, citrazone 25 mg meropenem, citrazone 25, citrazone 2 gram IV, plasmidernazole 5 mg, plasmidernazole 5 mg, MCIV equal to suppression hypertension, start neoepinephrine IV infusion to maintain MAP, more than 65 ml of cream. Add the vasopressin and epinephrine. Add vasopressin or epinephrine if needed. Investigation of monitoring blood culture, CBC, LFT, KFT, CRP, and procalcitonin, APC, urine output monitoring, ECG, chest X-ray, ultrasound, CTA, definitive surgery management, emergency exploratory laboratory or laparoscopic therapy, appendectomy, with peritoneal, appendectomy with peritoneal level, drain and abscess possible, drain abscess possible, supportive care, fluid resuscitation in hypovolemic shock, hypovolemic shock is a state of inadequate provision due to inadequate tissue provision due to decreasing inadequate tissue provision due to decreasing the intravascular volume, inadequate tissue provision due to decreasing intravascular fluid, due to decreasing intravascular fluid from hemorrhage, fluid loss, trauma, fluid loss and hemorrhage, trauma, GI bleeding, fluid loss because of vomiting, diarrhea, and because of the fluid loss because of hemorrhage, because of trauma, GI bleeding, and fluid vomiting, diarrhea, goal of fluid resuscitation, restore intravascular volume, maintain oxygen precision, maintain organ provision. HF MAP more than 65, maintain the urine output more than 0.5 ml per kg. Maintain urine output more than 0.5 ml per kg. Type of fluid use are we use cardiolite, first line, normal saline 0.9 sodium chloride. Regulate prefer in large volume resuscitation. Dose initial bolus 20 ml, initial bolus 20 ml per kg, over drop 30 ml, 20 ml per kg, over 30 ml, repeat bolus if needed, repeat the bolus if needed, repeat bolus blood use an hemorrhagic shock, blood product use an hemorrhagic shock, already significant blood loss, spec WBC to maintain the hemoglobin more than 7 gram, FFV fresh frozen plasma, coagulopathy is present. massive transmission protocol for we use one PRBAC, FFB implemented. Monitor during resolution. Vitals organ, PR, urine output, capillary refilling, major status, CVP, serum lytics, hematocrit, serum lytics, define SR, define SR, yes. Defining systemic inflammatory response syndrome (DSR). Systemic inflammatory response syndrome. Give a criteria for diagnosis of SR. So give 5 point related to choice of antibiotic prophylaxis. Systemic inflammatory response syndrome. Systemic inflammatory response system body response to inflammation. Etiology of infection non-infection. Mediator will be IL-1 6 TNF alpha. Parameter criteria with temperature more than 30 degrees Celsius or less than 36 direction. Heart rate more than 90 beat per minute. Respiratory rate more than 20 per minute. Or PaCO3 less than 32. White blood cell more than 12,000 mm or less than 14,000 or more than 10% band from one per freshman or more than 10% band or more than 10% or more than 10% from impaired freshman. Any two parameter present means SIRS. Temperature, heart rate, respiratory rate, and WC. Choice of antibiotic prophylaxis. Target expected organism. Choose antibiotic based on lipidolin, anti-surgical site, cefazolin for skin flora, cefazolin, metronidazole for anaerobic ingestion. Administration before insertion. Administer before insertion. Give first dose within 60 minutes before surgery. Incision for remote tissue constriction. Use narrow spectrum to reduce the resistant. Use narrow spectrum. To reduce the resistance. Slow duration, short duration, consider patient risk factor, allergic renal function. Short duration, consider patient risk factor. Consider patient risk factor, allergic renal function. Consider patient risk factor, allergic renal function. Hemolysis and transfusion, complication of blood transfusion, immune complication like hemolytic reaction, major ABO incompletely, immune complication. Hemolytic reaction, major ABO incompletely. This is the result of mismatched blood transfusion. This measure due to technical errors such as sampling, labeling, and display. This measure due to technical errors such as sampling, labeling, and display cause intravascular hemolysis, cause intravascular clinical feature there will be hematuria, pain in the lung, big valid pain, fever with seal and rigor, oliguria due to product of mismatched bone transmission, blocking of due to product of mismatched blood transmission, blocking the blood transfusion, blocking the renal tubule, resulting in acute renal tubular, resulting in acute renal necrosis, resulting in acute renal tubular, repeat coagulation profile, repeat coagulation profile, IV fluid. There is with furosemide 20 to 40 mg IV or injection mannitol, or injection mannitol 20% IV. Or injection mannitol 20% 100 ml IV to the flask flask kidney, the flask kidney. There's first made or injection mannitol to the flask kidney, the flask kidney. Minor incomplete occur due to extravascular hemorrhage, minor incomplete occur due to extravascular hemorrhage, usually male. There will be malaise, jaundice or fever. There will be malaise, jaundice. According to antibiotic, antibiotic to minorities due to antibody, according to antibody to minorities, non-hemolytic reaction, non-hemolytic reaction like fibroreaction, non-hemolytic fibroreaction, according to sensitization the white blood cell fibration according to sensitization the white blood cell open the increasing temperature no hemolysis use of 2040 ml for allergic reaction fibration allergic reaction according to allergic to plasma but the regular dresses all about the transfusion related acute inflammatory lung injury with Charlie, transfusion related acute lung injury, transfusion related acute lung injury, congestive cardiac failure, treatment, induction for emphasis complication, serum hepatitis A, serum hepatitis malaria, syphilis, serum hepatitis A, malaria, syphilis, other complications, other complication with cytotoxicity cause hypocalcemia, cause hypocalcemia, the delusion will be discussed in detail the different type of hemorrhage. What about indication hemorrhage of what are the indication of blood transfusion? Hemorrhage is the escape of blood from the blood vessel. Is the escape of hemorrhage due to ruptured injury and this type of hemorrhage according to the source of bleeding. There will be ultra hemorrhage, source of bleeding. Bright red blood, sputum in the rim, we have repeated blood loss. Bright red blood, artery hemorrhage, bright red blood, sputum in rim, sprinting in there, with the heartbeat, repeated blood loss, venous hemorrhage, dark red blood, venous hemorrhage, dark red blood, steady and continuous for capillary losing of blood from multiple small vessels, losing of blood from multiple losing of blood from multiple small vessels. Wow. How come, you know? Come on, no. So she's got to was not just thinking of Gun born case. I'm cook. I'm cook. According to the size of the bleeding, external hemorrhage, internal hemorrhage, externalized internal hemorrhage, externalized internal. According to the time of bleeding, primary hemorrhage at the time of injuries, reactionary hemorrhage within 24 hours, secondary hemorrhage after 7 to 14 days. According to the amount of blood loss, class 1. Class 1 more than less than 50%, class 2 50 and 30%, class 2 more than class 3 30 to 40%, and then class 4 more than 40%, class 4 more than 40%. According to the cause, traumatic hemorrhage, spontaneous hemorrhage, traumatic hemorrhage, spontaneous hemorrhage, surgical hemorrhage, metaphysical hemorrhage, metaphysical hemorrhage. Indication of blood transfusions. Peg red cell are used to replace the acute and major blood loss. Peg red cell are used to replace acute and major blood loss. Hemorrhage shock, major surgery, open heart surgery, gastrectomy, open heart surgery, major surgery, open heart surgery, gastrectomy, extensive burn. Major surgery, open heart surgery, gastrectomy, extensive burn. Peg red cell are also used to treat peg red cell are also used to treat anemia due to extensive burn, chronic blood loss. This is the extensive burn, chronic blood loss, hemorrhage, bleeding disorder, chronic blood loss, the hemorrhage, bleeding disorder, chronic duodenal ulcer, malignancy, nutritional malignancy, nutritional anemia, severe anemia, bone marrow failure, aplastic anemia, leukemia, bone marrow failure, aplastic anemia, leukemia, exchange transfusion, bone marrow failure, aplastic anemia, leukemia, exchange transfusion, coagulopathy, platelet disorder, platelet transfusion in thrombocytopenia, platelet transfusion and thrombocytopenia, platelet transfusion and coagulopathy, platelet disorder, platelet transfusion and thrombocytopenia, in thrombosis in thrombosis pellet disorder, pellet transfusion, thrombosis, a chest transfusion, bone marrow failure, aplastic anemia, leukemia, bone marrow failure, secondary hemorrhage. Bam bam bole, masti mamole. Deze gaan nou worden. Dames. Wim riumtje. Bam dolamtje uitlaten. Wam dolamtje.